Welcome to the 2024 ASCO Guideline Summary on Vaccination of Adults with Cancer. This presentation will provide you with essential insights into the latest recommendations for vaccinating adults undergoing cancer treatment. The primary purpose of these guidelines is to reduce the risk and severity of infections in adults with cancer. This includes patients with both solid tumors and hematologic malignancies, ensuring comprehensive protection across different cancer types. Key recommendations include assessing vaccine status at the time of cancer diagnosis and vaccinating 2-4 weeks before treatment begins. Non-live vaccines can be administered during treatment, and revaccination is advised after specific therapies like HSCT, CAR-T, or B-cell depleting therapy. Following CDC travel vaccine guidelines and encouraging household contacts to get vaccinated are also crucial steps. The guidelines recommend specific vaccines for cancer patients, including annual influenza shots, updated COVID-19 vaccines, and RSV doses for adults over 60. Tdap, TD boosters every 10 years, high-dose hepatitis B for immunocompromised individuals, and zoster vaccines are also advised. Pneumococcal vaccines are recommended based on age and risk factors. For patients undergoing HSCT or CAR-T therapy, vaccination guidelines suggest restarting vaccines between 6 to 12 months post-treatment, with live vaccines delayed for up to 2 years if GVHD is absent. Non-live vaccines can be administered after 6 months, while COVID-19 and influenza vaccines are recommended after 3 months. The guidelines highlight specific vaccine considerations, such as reduced antibody response after CD20 therapy for COVID, and the preference for high-dose influenza vaccines in older adults or those undergoing HSCT. Zoster vaccines remain safe post-cancer treatment, and pneumococcal vaccines show better efficacy if given before treatment. HPV vaccines are particularly important for young survivors, and hepatitis B titers should be checked and repeated if necessary. Vaccination of household contacts is generally safe and encouraged, with exceptions for oral polio and live smallpox vaccines. Caution is advised regarding post-vaccine rashes, such as those from varicella, to ensure the safety of cancer patients. To effectively implement these vaccination guidelines, it's important to document vaccine history at the first visit and vaccinate early when possible. Coordination with primary care providers, pharmacists, and nurses is essential, along with providing education to reduce vaccine hesitancy. Ensuring caregiver immunization is also a key component of successful implementation.